Good evening. I'm Dr. Alicia Rebar, Executive Associate Dean for Academics and Accreditation here at the College of Nursing. I would like to welcome you to this ceremony on behalf of Dean Andrews, who is unable to be with us tonight for your white coat. It's an incredibly special day that is both symbolic for your entry into the practice of advanced nursing, as well as a celebratory occasion for your family and friends. Today marks a major milestone for your future as a nurse practitioner or nurse educator. Family, faculty, friends, staff, let us give our students their first round of applause today. I would like to introduce the platform party. When I say your name, if you just stand up so that they know who you are. The first is Ms. Cheryl Nelson. She's the Assistant Dean for Student Affairs in the College of Nursing. Next is Dr. Rachel Bush, Interim Co-Director of the Psychiatric Mental Health Nurse Practitioner Program, as well as this evening's speaker. Dr. Alyssa Sherrill, she is with the medical group of the Carolinas Pediatrics from Boiling Springs, who will also bring brief greetings to you from our alumni. Ms. Melissa Kepper, who is the Director of our Graduate Student Affairs. Dr. Amy Dievendorf, who is the Director of our Adult Gerontological Acute Care Nurse Practitioner Program, and Dr. Shelley Gibbs, who is the Director of our Family Nurse Practitioner Program. And finally, Dr. Bev Belico, who is also an Interim Co-Director for our Psychiatric Mental Health Nurse Practitioner Program. Don't fall off the stage. And of course, the true heart and soul of our college, our faculty. I hope all of you take the opportunity to really get to know these incredible faculty members who are sitting over here during your journey here. I would like for all of the faculty to stand and be recognized. I personally want to thank them all for everything that they do. Thank you, particularly during Nurse Practitioner Week this week. Yay. We often share that it takes a village to support our students during this rigorous and stellar program. Many of our family members today drove hours to be here or flew from around the country to support you in this ceremony today. Family members provide much needed support along this journey, and we would like to recognize you at this time. Graduate students, if you would please stand, turn around, and give your spouses, parents, siblings, children, or other special guests a round of applause, that would be helpful. And thank you for all of your support that you do for our students. We have graduate students participating who are enrolled in either our adult gerontological acute care nurse practitioner program, our family nurse practitioner, or our psychiatric mental health nurse practitioner programs. All of these students are in their early phases of clinical rotation and are here for their first on-campus immersion. I want to thank you for choosing the University of South Carolina for your graduate nursing education. You have chosen an incredible place. We are currently ranked #1 in the country by U.S. News and World Report for our graduate online programs and are in the top 1% for our pre-licensure NCLEX pass rates and 100% for our NP programs as well. So you've picked a really good place to come and continue your education. We aspire to excellence and quality in all that we do and uphold our values, which are professionalism, integrity, diversity, respect, caring, inclusion, and commitment. The faculty and staff are committed to your success, and we look forward to your journey. So on with the ceremony, I would first like to introduce our first speaker of the night, which is Dr. Alyssa Sherrill. She's going to bring greetings on behalf of our alumni. Alyssa is a dual certified family nurse practitioner. She specializes in pediatric medicine and is employed at the medical group of the Carolinas Pediatrics in Boiling Springs. She received her associate degree in science at Spartanburg Methodist College, her BSN at the University of South Carolina Upstate School of Nursing, and her DNP at the University of South Carolina College of Nursing here in Columbia. Alyssa served as the president of Kappa Sigma Alpha Service Fraternity at Spartanburg Methodist and completed over 1,000 hours of community service. While at USC Upstate in Spartanburg, she served as the president for the Student Nurses Association, and she's a proud member of Sigma Theta Tau. She obtained her certifications through AANP and ANCC, and she also serves on the Nursing Research Council, is a Lean Six Sigma team member for the Dysphagia Screening area and is on the organ donor committee at Spartanburg Medical Center. While employed at Spartanburg in the emergency department, she worked alongside the SANE, or sexual assault nurse examiners. Because of this experience, she wants to further her education in pediatric forensic nursing. Please help me in welcoming Dr. Cheryl.
Good evening, ladies and gentlemen. My name is Alyssa Sherrill, and I'm a pediatric nurse practitioner in Bowling Springs, South Carolina. It is my honor to be invited here this evening, allowing me to offer a few words of encouragement on this day, the day of your white coat ceremony. Wow, I can remember my ceremony as if it were yesterday. Walking in here tonight, it was surreal, because it was full circle. What a monumental day. Your white coat ceremony is an outward celebration that you are now entering the next phase and becoming an advanced practice registered nurse. Your white coat is a symbol of dedication, compassion, professionalism, and authority in your patient's care. By wearing this white coat, there are expectations and responsibilities that I have no doubt each of you are ready to embrace. You have earned the honor of wearing your white coat. I am positive that for many of you, this task did not come easily. You have boldly overcome odds that were stacked against you along the way through hard work and resilience. There were many, many days of working long hours in the hospital, only to come home to study and study and study some more. I look back on sacrifices that my family, specifically my mommykins, as I often refer to her, made for me to be able to earn each of my degrees. I remember my mother spending countless nights staying up with me to help me study, encouraging me, feeding me when I forgot, and allowing me to cry out my frustrations, most importantly, praying for me. Of course, rest assured, it was her prayers that got me through many of those sleepless nights, and she was and still is my rock. Both of my grandparents were terminally ill. Growing up, I watched my mother silently and selflessly care for them while working a full-time job and still managing to be there for my brother and I. She was the epitome of the compassion and dedication I spoke of earlier. I believe that it was during this time that I decided in my young heart that I wanted to be a caregiver. I wanted to use my life to make a difference. When I graduated high school, I had every intention of becoming a broadcast journalist. At that time, weighing all of 95 pounds, I could envision myself as a reporter standing in the hurricane attempting to report those conditions around me while holding onto that flagpole, knowing that I was going to fly away. Picture that if you will. Go ahead, I'll let you. As I envisioned this, I began to reconsider that career choice and thought to myself that being a broadcast journalist might not be the right career for me. I discussed with my school advisors and began pursuing the path to my destiny, my calling, of being a healthcare provider. I'm in awe that I look back today on my DNP journey. I obtained my associate's in science at Spartanburg Methodist College in 2014, then applied to USC Upstate and earned my Bachelor of Science in Nursing degree in 2016. During this time, I worked at Spartanburg Medical Center, first as an ER tech, and then being hired as a registered nurse in the emergency department. I quickly realized there was more that I was meant to pursue. I applied and accepted to the University of South Carolina College of Nursing, and it is here where I began my DNP journey. I graduated with my Doctor of Nursing Practice degree in 2020. I sat for and obtained my dual certifications as an AANP and ANCC. After graduation, I worked in the immediate care setting for 2 years, and then I accepted my dream position as a pediatric nurse practitioner last December. To say I love my job is an absolute understatement. It's so rewarding. It was a hard road, and I know each of you have traveled your own road to get here today. Some of you have had to overcome significant obstacles to be seated here tonight. I applaud you. Be proud of that. Be proud of yourself as you enter this new phase in your education. You will begin moving forward in your next cluster of courses, and you will most definitely be faced with new challenges. Balancing clinicals, classes, work, and family will become second nature to you. I know that sounds a little daunting. However, you've made it here today by overcoming those same difficult challenges. As you don your white coat tonight, you will find yourself making clinical decisions and writing orders rather than taking them. You will have direct impact on the treatment and outcomes of your patients, and I recommend you always stay up to date on the ever-evolving practices of literature and working to continue providing excellent evidence-based care. You'll hear that word a lot in school. You will soon take on the role of provider. It still gives me chills. You will need to earn the respect and trust of your patients and your peers. Remember that it's good to be confident, but also remember that you do not and cannot know it all coming out of school. Learn from your peers and your mentors. Learn from your patients and learn from your experiences. If I can offer you anything at all to take away this evening, I'll offer you these tidbits of advice. You're being taught by the best, most knowledgeable professors in the nation. They are here for you. Learn from them. Lean on their resources, their wisdom, and their knowledge. Study hard. Make every experience a learning experience that you will carry with you throughout your career as a nurse practitioner. When you make a mistake, and you will, own it, learn from it, and then move on. Remember your why you became a nurse in the first place. When you feel defeated and you seem that you have lost your compassion, remember your why. Not only remember, but live the golden rule daily. Do unto others as you would have them do unto you. In other words, put yourself in their shoes. Always treat them how you would want to be treated. And then also remember, treat yourself as your loved ones would want to be treated. Your integrity should never be in question. Provide compassionate, competent, and excellent care. Always do the right thing, even when you think no one is watching, because someone is always watching. Remember to always treat every patient with dignity, no matter their race, religion, their lifestyle, or their poverty level. Be assured that in the words of Maya Angelou, the patients and their families may forget your name, but they will never forget how you made them feel. Do not forget where you come from. Remember to never neglect your family and friends that loved you and supported you along the way, because you're important to them. Wear your white coat well and with pride. Prove you are worthy of wearing it every time you walk into a patient's room. You have worked hard and deserve to be here. In conclusion, the journey you are embarking on will be challenging. There will be long nights, and you will have failures and successes. But I can promise you this, it will always be worth it. So hang in there when the going gets tough. Remember, you are amazing, you are confident, you are enough, and you can make a difference. Congratulations to each of you. You have earned your white coat.
Because then you'll be able to take care of me. Next, I would like to introduce Dr. Rachel Bush, who's an assistant professor of nursing and the co-director of our psychiatric nurse practitioner program at the university. She is a board-certified psychiatric mental health nurse practitioner and as well as a licensed professional counselor, and has worked in the mental health field for over 25 years in both fields of nursing and in counseling. Her present clinical practice focuses on the treatment of depression, trauma, and anxiety disorders. Her varied research interests have included innovative pedagogy, spiritual care, trauma in post-war refugee populations, as well as mindfulness practices for mental health well-being. Please help me welcome Dr. Bush.
It is a true honor to be here tonight with our esteemed faculty, our distinguished guests, and most importantly, our exceptional nurse practitioner students, as we celebrate this momentous occasion, the White Coat Ceremony. This event signifies a profound landmark in your journey towards becoming nurse practitioners, and it truly is a privilege to be here with you on this important day. Although I do not know each one of you personally, there are some things that I do know about you and your ability to be here today. Firstly, you have compassion. There's a reason that nursing is referred to as the caring profession. As you become nurse practitioners, your ability to listen, empathize, and offer comfort will be essential in providing the highest quality care. Nurses are distinguished by the ability to treat people, not just diagnoses. Technology, diagnostic manuals, and evidence-based treatments are essential in practice, but the greatest tool that you have is your heart. There is a reason that we are called nurse practitioners. Being a nurse is a distinction that offers our patient a dynamic of care that is unique and specific to our profession. Don't forget to see your patient. Treat the person, not just the disease. Your compassion will be a source of healing itself. Another thing that I know about you is you have determination. Your journey to this moment has been filled with countless hours of study, clinical experiences, and dedication. You have overcome hurdles, pushed boundaries, expanded your horizons, and adapted to shifts in roles and responsibilities. This life that you are about to enter is a journey and not a destination. It is something that you will be and do every day. You will not always know the answer to all the questions you are asked, and you will get tired, and you may feel like an imposter at times and wonder if you have made the right choice. But you will persevere. Providing health care may offer many struggles, but nurses don't give up. As Dorothea Dix, a nurse from my own specialty, once stated, "They say nothing can be done here, and I reply, I know no such word in the vocabulary I adopt. There will be challenges and hurdles, but you have proven to be up for the task." Another thing that I know about you is you have a calling. Out of all the healthcare traditions, nursing has the best history of holistic care. We treat body, mind, heart, and spirit. And the role of calling recognizes that becoming a nurse practitioner is not just a career choice, it's a life choice. It's a willingness to take on the messiness and the pain of humanity while providing hope and providing healing. This life choice may keep you at home or take you other places, or may take your skills even to another country or another part of the world. Keep your hand open to the possibilities of how you may contribute. Another thing that I know about you is you are capable. Look how far you've come. You have already been able to endure the rigors of academic requirements and clinical performance and are ready to take the next step. Nursing has a tradition of giving its students powerful symbols of change, progression, and maturity, while also bestowing a sense of mission or responsibility. Historically, it's been a cap and then a pin, but tonight we have the white coat. The white coat represents the significant responsibility and the immense trust that has been given to you as a future healthcare provider. It is also a reminder of the profound commitment that you make to the well-being of others. As you receive your white coat today, consider it an honor to wear it, and remember that your journey is just beginning. And as a personal encouragement from someone who is seasoned enough to know, enjoy your moment. Don't miss a part of it. Don't miss your present trying to get to the next moment faster. Savor each minute as it comes. In conclusion, today's white coat ceremony is a testament to your hard work and to your dedication to patient care as you embark on this role in this profession. Wear your white coat with pride. Congratulations, future nurse practitioners. I have no doubt that you will make a lasting and positive impact on the lives of the patients you will serve, and I can't wait to see it. Thank you.
So a little history on the white coat. What is this white coat ceremony all about? The white coat originated for use in a scientific lab and was adopted as the standard of dress by physicians in the late 19th century, when those physicians sought to incorporate scientific principles into the practice of medicine. The white coat ceremony was created by Arnold P. Gold Foundation more than 25 years ago for medical students. And in 2014, the Gold Foundation and the American Association of Colleges of Nurses marked coordinated efforts to develop a ceremony for nursing students. The donning of the white coat is a long-standing tradition which distinguishes healthcare providers from other community members. The white coat is a symbol of our profession, of professionalism, integrity, honesty, excellence, compassion, and sacrifice to unconditional care for others. For a USC nurse practitioner student, it symbolizes the accomplishment of successful completion of your core nursing courses and a student's beginning of their clinical rotations. It also signifies and honors our College of Nursing values of diversity, inclusivity, commitment, caring, integrity, respect, and most importantly, professionalism. Your white coat will serve as a symbol and honorable recognition as a healthcare provider and as a repository for resources including handbooks, manuals, reference cards, stethoscopes, pen lights, your cell phone, so much more. Now, let us meet our deserving USC College of Nursing graduate students. I'd like to present Ms. Melissa Kupfer for the presentation of our white coats.
Tonight, we are recognizing students in our adult gerontology, acute care nurse practitioner, family nurse practitioner, and psychiatric nurse mental health practitioner programs. At this time, Dr. Amy Devendorf, director of the AGA CMP program, assisted by Dr. Shelley Gibbs, director of the FNP program, will welcome and present coats to the students in our Masters of Science in Nursing, Adult Gerontology Acute Care Nurse Practitioner program. Ms. Cheryl Nelson, Assistant Dean for Student Affairs, will also congratulate these students. Would the students please come forward? Adam Bates. Shelby Craig. Harley View Lancaster. Kate Goss. Lauren Gill. Colin Green. Elena Hall. Mallory McGee. Marianne Malazzo. Sufana Sibtong. Now, Dr. Diebendorf will assist Dr. Gibbs with presenting codes to the Master of Science in Nursing degree students in the Family Nurse Practitioner program, followed by the Certificate of Graduate Study and Doctor of Nursing Practice degree. Erica Adams. Abigail Benton. Nicole Berry. Emily Billman. Bianca Braga. Megan Couture. Kelly Foster. Emily Goad. Allie Goodman. Savannah Hale. Casey Jones. Kristen Lemers. Mallory Lewis. Sarah May. Imani McGee. Damani Patel. Natalie Sanchez Sacco. Megan Schultz. Angela Shabachka. Brianna Simpson. Beth Singletary. Morgan Sophie. Emma Webster. Tia Williams. Mandy Wilson. Maggie Windsor. Nidhi Kumar. Allie Pierce. Newlywed. Jaylene Jellicoe. Adrian Schroeder. Now, Dr. Beverly Belico and Dr. Rachel Bush, interim co-directors of the Psych Mental Health Nurse Practitioner Program, will present codes to the Master of Science in Nursing degree students in the Psychiatric Mental Health Nurse Practitioner Program, followed by the Doctor of Nurse Practice degree students. Caitlin Alexander. Carrie Baker. Anna Bowles. Jesse Brazil. Amanda Guerrera. Lane Kesner. Amy Lineberger. Alexandra Markel. Catherine Riley. Matt Steeman. Brian Ward. And last but not least, Catherine Harding. This concludes the presentation of our students. We congratulate you on your accomplishment in being admitted to such well-recognized program.
Okay, now I'm going to ask y'all to stand. And we're going to do the white coat ceremony oath, which is in your program on the last page. So if y'all can turn to that and repeat after, or repeat with me. All right, you ready? So as a nurse dedicated to providing the highest quality care and services, I solemnly pledge that I will consider the welfare of humanity, relief to suffering, my primary concerns, act in a compassionate and trustworthy manner in all aspects of my care, apply my knowledge, experience, and skills to the best ability to assure optimal outcomes for my patients, exercise sound professional judgment, operating legal and ethical requirements, accept the lifelong obligation to professional knowledge, promote, advocate for, and strive to protect health, safety, and rights of the patients. With this pledge, I accept the duties and responsibilities that embody the nursing profession. I take this oath voluntarily with all ability, which I do. All right, you can have a seat now.
Okay, so you're all official now. What a privilege to see the next generation of nursing students who are the future of nursing. We are so glad to have your family and friends join us on this occasion. I would like to thank the OAA staff for their help in planning this ceremony. And I would like to especially thank Ms. Cheryl Nelson. This is her last white coat ceremony before her impending departure from our college, so we would like to thank her for all of her hard work over the last, I don't know, decade or 2 or 3. After this, I would like for all of the faculty and students to recess to take a picture. So we're going to go out onto the stairs at the entrance of the Alumni Center, and we're going to fan out, and we're going to get a nice photo, okay? And then all the photos that we had taken tonight will be available online, and that will be sent out to you. So if first the platform party is going to exit, and then the students can exit, and then after we have the picture, you can come back in and meet your family for refreshments here in the lobby. Okay, but before we leave, I would like for all of us to take a moment. So flip to the back of your little brochure there, and we're going to sing one verse of the Alma Mater. And when we sing the words, "Here's a health, Carolina, forever to thee," you raise your right hand like you're making a toast. Okay, so welcome and congratulations again, and best of luck on the rest of your programs.
Please stand. Yes, as well.